A zoonotic henipavirus in febrile patients in China. The New England Journal of Medicine. The Hendra virus and the Nipah virus, which belong to the genus Henipavirus in the family Paramyxoviridae, are known to infect humans and cause fatal disease. However, other related henipaviruses have been detected in bats, rodents, and shrews. During sentinel surveillance of febrile patients with a recent history of animal exposure in eastern China, a phylogenetically distinct henipavirus, named Langya henipavirus, LAV, was identified in a throat swab sample from one patient by means of metagenomic analysis and subsequent virus isolation. The genome of LAV is composed of 18,402 nucleotides with a genome organization that is identical to that of other henipaviruses. LAV is most phylogenetically related to Mojiang henipavirus, which was discovered in southern China. Subsequent investigation identified 35 patients with acute LAV infection in the Shandong and Henan provinces of China, among whom 26 were infected with LAV only, no other pathogens were present. These 26 patients presented with fever, 100% of the patients fatigue, 54% cough, 50% anorexia, 50% myalgia, 46% nausea, 38% headache, 35% and vomiting, 35%, accompanied by abnormalities of thrombocytopenia, 35%, leukopenia, 54%, and impaired liver, 35%, and kidney, 8% function. A serology of domestic animals detected seropositivity in goats, 3 of 168, 2%, and dogs, 4 of 79, 5%. Among 25 species of wild small animals surveyed, LAV RNA was predominantly detected in shrews, 71 of 262, 27%, a finding that suggests that the shrew may be a natural reservoir of LAV. Although the current study does not fulfill Koch's postulates, the following findings from the patients with acute LAV infections suggest that LAV was the cause of febrile illness. LAV was the only potential pathogen detected in 26 of the 35 patients, 74%, with acute LAV infection. In paired serum samples that were obtained from 14 patients during the acute and convalescent phases of infection, the IgG titers in 86% of the convalescent phase samples were 4 times as high as those in the acute phase samples. Viremia was associated with acute LAV infection, and the patients with pneumonia had higher viral loads than those without pneumonia. Although human-to-human transmission has been reported for the Nipah virus, we found no obvious spatial or temporal aggregation of human cases or the assigned haplotypes on the basis of 3 common single nucleotide polymorphisms. There was no close contact or common exposure history among the patients, which suggests that the infection in the human population may be sporadic. Contact tracing of 9 patients with 15 close contact family members revealed no close contact LAV transmission, but our sample size was too small to determine the status of human-to-human transmission for LAV. The potential cross-reaction with Mojiang virus should be assessed to improve serologic testing.